Steward Healthcare was, at one point, the largest private hospital system in the country. When the private equity-backed network filed for bankruptcy last year, it devastated providers and patients.
In Massachusetts, 5 of the 8 Steward-owned hospitals were salvaged by the state, but 2 were shuttered. Economics correspondent Paul Salmon went to see what and how it happened.
At first, hope.
We thought when they came in, great, we're going to have a bigger company, they're going to put money into it.
Money from a rich and supposedly savvy private equity firm, Cerberus. And the new hospital network, Steward Healthcare, would be run by a noted heart surgeon, Ralph de la Torre. For struggling hospitals, an injection of cash, plus medically minded leadership. A good match, right?
It was just run so poorly and so mismanaged.
Elaine Graves was a nurse at Kearney Hospital in Boston's relatively poor Dorchester for nearly 50 years, before it's being shuttered last summer. Because, says Graves, after Cerberus bought the hospital in 2010,
things were being broken, elevators, they weren't working, we're down to one elevator.
Audra Sprague was a nurse at another Cerberus Steward hospital.
Over the years, it was one cut after the other and staffing cut. We were on credit hold because we weren't paying our bills.
The MO of private equity leveraged buyouts, the buyer, in this case Cerberus Steward, goes to a lender for a many $million-dollar loan. Gets the money, that's the leverage, which just means debt, which it then uses to buy properties like a hospital. The property then has to pay off the debt. One way to do that, cut costs, ignore bills.
People would come in for surgery. They couldn't get the equipment, so they had to send them home. Sorry. It happened all the time. They owed so much money to creditors for equipment that they wouldn't give it to them anymore.
We heard it time and again, unpaid bills, cuts in resources. And yet a Boston Globe investigation found that CEO de la Torre traveled by private jet and managed to buy a $40 million yacht. Steward's bankruptcy made national headlines. Private equity Cerberus, which sold Steward for an $800 million profit, was blamed. Cerberus wouldn't go on the record to us, but provided additional background last fall, claiming complaints and lawsuits, quote, appear to be overwhelmingly related to the post-Cerberus ownership period and portray a stark contrast to Cerberus's ownership period, during which Steward was delivering high-quality care to millions of patients and employing thousands of hardworking professionals. But nurse Elaine Graves, who does seem like a hardworking professional, began to notice cuts soon after the buyout, years before the private jet. And then
they just kept chopping until there was nothing left.
Does she blame private equity ownership?
Yeah, because they're the one that took everything away from these patients and from the community.
So, where do patients go since the hospital closure in Dorchester?
They're going into the Boston hospitals and overwhelming those hospital emergency rooms. Ambulances are waiting out in the parking lot for an hour, hour and a half, just to get into the hospital.
No surprise, as 40 miles northwest of Boston and Ayer, same story. Neshoba Valley Medical Center, also part of the takeover, also shut its doors.
We've had a hospital in Ayer for over 120 years, in the current site for 60 years.
Town manager Robert Pombrian.
We lost the health care not only for Ayer, but for the Neshoba Valley region. 600 jobs are gone, and we're still feeling the pain. The impact to the emergency management system is put it into a crisis threshold.
That would be the town fire department.
Most of our calls are EMS. The vast majority of time we spend in the day is prepping for EMS.
How long for an emergency when Neshoba was open, called to delivery at the hospital?
We could do that all in about 30 to 40 minutes.
Now?
Anywhere from an hour to 2, depending on where we're going.
And when the ambulance does get to nearby hospitals, they're now swamped.
It's been chaos here.
Neshoba nurse Audra Sprague.
There's another hospital that's a community hospital as well, about 15 miles from where Neshoba was, but it's already overwhelmed, and they've seen a 20% increase in their emergency room visits since we closed.
And it's not just a loss of the ER.
Ended up getting pulled up into the air.
Professional tree trimmer Chris Martin.
And then when I let go, the limb came down, crushed my ankle and broke my leg, and then fell sideways, breaking 2 ribs on this side, all my ribs on this side, punctured the lung, gave me a brain bleed, destroyed my ear, fixed my ankle with pins, and then trying to get into rehab because Neshoba closed, and it's taken me 9 weeks just to get into a slot because they're all so inundated with all the people coming from Neshoba.
And while he had to wait, he got worse.
I'm getting more and more headaches, and that's why I ended up going to the emergency room last week, because my headaches, they usually only lasted about an hour, and they've been lasting longer and longer and longer. We had to drive all the way out to Worcester because the hospital's closed. So we got there in the afternoon, 2:33, and then we didn't get home till 1:30 in the morning.
And that's just for neurology, says his wife, Allie, who was a receptionist at Neshoba.
If you have one injury, you get discharged, you have one doctor you're following up with. Well, he's got 7 different doctors he's following up with.
Scattered all across the region.
All of his follow-up, we probably could have done at Neshoba. So the chaos of trying to do everything at a hospital where our primary care isn't affiliated is one difficulty. And spending 9 hours at an ER just to get a CAT scan to make sure his head bleed didn't start again, or there was something acute that was happening. It just shouldn't take that long.
Meanwhile, a sudden call to deliver another man who fell from a tree to a medevac helicopter to get him to the nearest hospital quickly. But the copter was grounded. A 7-minute ride became a 45-minute ordeal. So is what happened in Ayer and Dorchester a one-off? One company with an unscrupulous CEO? Or is it not that unusual when private equity gets into healthcare? Stay tuned for our next report. For the PBS NewsHour, Paul Solman in Dorchester and Ayer, Massachusetts.